see you bought your girl one.
Hi everyone, I'm Dr. Sharon Livingston and I'm here for Small Business Diva. And I want to tell you a little bit about Small Business Diva, the concept I had here. I'm an expat New Yorker and I came to New Hampshire and I was just blown away by the talent that we have here. There are people here with such a passion for their business. And the reason for Small Business Diva, aside from the fact that I'm so full of myself, is that a diva sings the praises of people. And that's what this show is about, singing the praises of people with passion for their work and their business. And one person that I want to introduce you to right now is Sheila Simone of Act 2 Salon. So Sheila, thank you so much for taking part in our show.
Oh, it's my pleasure. Thank you for inviting me.
And can you tell people a little bit about Act 2 and what your vision is?
Sure. Act 2 Salon and Medical Spa is a unique salon because what we offer is all under one roof. So everything is to the benefit for the customer to have personalized attention. Working with the team, we give individualized attention. So we have hair and makeup, we have master stylists, colorists that can change the whole image of someone's hair, and then we work along with makeup and nails, which most salons provide. But our uniqueness is that we have cosmetic doctors who can also take the next level. We have cosmetic dentistry for teeth whitening and veneers. We also have Botox, Restylane, Juvederm, fillers, and a new product that's out, which is the Pelave, which is a skin tightening treatment. It's amazing.
Tell me about that.
It tightens your skin, it mimics a facelift, and it's non-surgical, it's non-invasive, so it's very affordable, which is another thing. It can price range for a full face about $500, which is great because you see immediate results. It produces collagen, and it's something that you can do in an hour and have no downtime, and I think that's great.
That's fantastic.
Yeah,
that's
we love
fantastic.
it. Yeah, so the doctors all work together in finding the correct look to soften and keep us more youthful and keep us from aging in a bad way. We want to age gracefully.
That's excellent.
Yeah.
And so what I love about Act 2, and I came here by accident, someone actually, Dr. Bloom, the cosmetic dentist,
Yes.
told me about the salon, and I had been going other places, and I came by and I was like, wow, this is incredible. And first of all, you are the sweetest thing in the entire world.
Thank you, Sharon.
You feel like a very close friend now.
Thank you.
And I think you make everyone who comes here feel really valued and cared about. And you consult with everyone saying, maybe this and maybe that. And what's so exciting to me today is that we have someone who is going to go through that whole process with you. We're going to do the consultations today.
We have a great makeover model, and we're going to take her from the top. We're going to start with her hair, her makeup, her nails. Then we're going to bring her to the doctors and have them give us our advice on what will be best for her. We also have nutrition and fitness. We do Pilates and yoga and Zumba classes. I will develop a personalized diet for her. Really just food, how to eat, when to eat, what are the proper foods to eat that are going to keep your skin and your hair and your nails beautiful, but also keep the weight down. So it's a way of life. It's not really a diet plan. We'll help her out with that. We have a nutritional supplement, Relive, which we think is one of the best, and we're going to get her on a program for that as well. We also have Fashion Avenue, which is a great clothing boutique. And I travel all around the world getting the most unique clothes, and Sharon and I are modeling them right now. And we'll dress her and we'll help her find a look that will flatter her figure and get her on the right track, so she's going to feel good from the inside and out.
So what do you think? Should we bring Judy over and maybe you could start talking about, hair, makeup, those things?
Get her started, We're really excited to give her a great new makeover. She's a great person. She's up for a change, and she's in scrubs all the time. She comes to the salon, but she doesn't have a lot of time to spend on herself. So we're going to help her. We're going to help her feel great about herself so that she's going to be happy and out, and her whole life will change.
Well, in just a moment, we're going to introduce you to Judy, so we'll see you in a second.
Do you wanna dance? I can see the way you checking me, that you wanna dance tonight, baby. Let me show you how. I can feel.
Well, welcome back, and we're here with Judy Nassif and Sheila Simone. And so Sheila, what are you going to be talking about with Judy at this point?
Well, I think we'll first start with her hair. And you know, when your hair looks great, life is good. When you feel good about your hair, it makes life much easier. With Judy, she has gorgeous hair already. It's very, very
She really
pretty.
does.
I want to just enhance her a little bit, Sharon, and I'm thinking that with the shape of her face, I'm going to have my master stylist, Lisa, cut her hair, and maybe we're going to bring it up a little bit so that it coordinates with the shape of her face. Then we're also going to have our master stylist, Donna, do some lightening. Just give her a little face framing foil, something to brighten her up, maybe in an auburn caramelly shade. We are going to have our extension specialist, Jesselyn, put a few extensions in the reds, because as we all know, when we color our hair red, it fades easy. This will be less maintenance for her, and if she wants to change the color, we take them out and we put a different color in. So we're going to be adding a few extensions for accent pieces
How about
as well.
feathers? I heard we have feathers
Hair
now.
feathers are amazing, and we can do that if she has a party or a special event and she wants to go out in it, but I think we want to give her more of a classy, sophisticated look, and I think just by giving her a really nice style. Her lifestyle, basically, she works and she likes to get out and do things and be with people, so we want to freshen her up and give her a whole new look.
How does that sound for your hair?
Sounds wonderful.
Yeah.
It's a nice change.
Then the next step will be makeup. And we have Alyssa, our makeup artist, who is going to choose the correct colors. And we'll have Colleen, our esthetician, shape her brows. And basically, she'll be the perfect palette for the doctors to come in and take a look and see what we can do as far as skincare.
Excellent. Excellent.
Yeah.
So should we bring in Dr. Beck?
I think that would be great. Dr. Beck will help you, and you're going to be rejuvenated, and it's going to be great. So I'm
Sounds
very
good.
excited.
Excellent. Great. Okay, so we'll be back in a second with Dr. Beck.
Oh my gosh, it's like
Your hair looks so adorable.
I put my hands up and I was like, wow.
I think you really are the prettiest little princess.
Friends in the family.
Are you going to be the flower girl? Yeah?
I love the back. She is, yeah.
Oh my God, she looks beautiful.
It's perfect.
Well, this is Dr. Adam Beck. Dr. Beck, so nice to meet you.
Thanks for having me here.
Tell us a little bit about your practice.
So I'm an ophthalmologist, but also a facial specialist. I specialize in both the retina side of ophthalmology and also the facial side.
I love it.
Yeah.
What a great idea. I was wondering about fusion. I thought, oh God, he's going to fuse all my wrinkles. That would be fantastic. And so this is Judy Nassif, and you've met her before. And so, Judy, do you have any questions for Dr. Beck?
No.
You're just like hoping for the best?
Hoping for the best, you know.
So we have our 6-week makeover happening here, Dr. Beck, and what do you think we could accomplish? And maybe that's a step along the way or whatever, but how do you see it?
So just looking at Judy, we see right away, I start with the forehead, and there are some fine lines up here that we can get to relax out with Botox. Now Botox is a treatment that lasts about 3 months, and we do several injections on the forehead. It doesn't hurt, it's not painful, and it really gets these fine lines to relax out. It's best used here, here, and out here. for
And what can
crow's
she
feet.
expect from that?
She's going to get these fine lines here in the forehead area to really smooth out. So
Like
that,
your forehead?
yeah.
You're really 96, aren't you?
I am. All right, so we'd start here, and we'd start with the crow's feet as well, and we'd give a little bit of Botox here. As we work our way down the face, there you can see as we age, we develop a little bit of a furrow here, and everyone does. This is really common. We use fillers, either Restylane or Juvederm. Also fat, we can use that as well. But
Want to borrow some of mine?
Yeah, I have my own.
Restylane and Juvederm are really nice because they're reversible. So if a patient doesn't like it, then we can go back, we can reverse it right away.
Have you ever heard of anyone not liking it?
No,
Yeah.
no, everyone loves it.
Yeah.
Everyone loves to look younger. So I would return here. I would fill in this area here with Juvederm, and I think you do really well. As far as the modeling of the skin here and the sunspots, we call them age spots, we can really do a couple of things. One, we can do a laser treatment, a fractional CO2 laser treatment to really sort of soften the pigmented areas. And that'll help nicely. If we don't want to go extreme, we can also set her up with an Obagi system. So it's a at-home peel system that you do every day for about a month, and this will get the spots here to really
Does that do
fade.
the same thing as the laser?
No, it's not as strong. It does the same thing. It's just not as invasive. It's not as strong.
And it takes
doesn't get as
longer.
deep, and it takes longer. One other
Can you
thing.
do both?
Yeah, we absolutely. The two go hand in hand.
Cool.
One other thing we can do, you can see here that we have a little bit of excess skin here under the eyelids and over the eyelids, and we haven't really sat down to talk about it. This would be perfect for eyelid surgery. If you look at the excess skin here, you'd have a really good result if we just took a little strip called blepharoplasty surgery on the upper lid and on the lower lid. As we age, you can see the fat pockets below the eyelids. They tend to protrude a little bit. It's really common. It's a normal part of
I remember my
getting
dad
younger.
had bags under his bags. I mean,
Yeah.
I don't know how we did it, but my God. Yeah,
Sure.
that's awesome.
In the salon here, right here, the other thing we can do is called the Pelivate treatment. If we don't want to go as extreme as surgery, we can also offer just
What is Pelivate?
it's a radio frequency tightening system, so it really tightens the collagen in the skin, and that'll give you some tightening here under the lid and over the lid. Certainly not as good as surgery, as invasive surgery, but it's also an option we can talk about and we can do right here.
How long does that last?
Between 1 and 2 years, so it's actually pretty good. It won't give you as big of a bang for your buck as surgery would, but some
It's
people
less
just don't want.
invasive.
Yeah, it's
Right.
less invasive. So
Right.
it's also an option here we can
I'm
do,
trying
and
that.
it'll
It sounds great.
and sure, and it'll tighten you here, and it'll actually help some with the crow's feet. And if we do the whole face when we do it, so it's actually going to help you extend out the Botox treatments
Are
as
they
well.
going to have Pelivate for the butt?
That should be the next thing.
I
shouldn't it?
think so. I
Yeah.
think that'd be great.
Yeah.
For all those little dimples you didn't really want.
Yeah. All right.
Excellent.
Do you have any
Are
questions?
you psyched?
Yes, I am. Yeah.
Exciting.
Good.
Excellent. Thank you, doctor.
No problem.
So, and next we're going to be talking to Dr. David Bloom, who specializes in cosmetic dentistry, and I know him really well because I have the teeth to prove it. So,
Very cool.
we'll see you later.
All right. You take
Thank
care.
you.
Thanks.
Thanks.
Do you wanna dance? I can see the way you checking me. That you wanna dance tonight, baby. Let me show you how. I can feel the way you step to me.
Oh, good boy.